woman walked into my office 4 months ago, 73 years old, former school teacher. She had been walking 40 minutes every single morning for the past 3 years without missing a day. Her cardiologist praised her for it. Her general practitioner called it the best thing she could do at her age. She came to me because she had developed bilateral knee pain so severe she could no longer descend a staircase without holding both rails. Her hip flexors had shortened to the point where she could not stand fully upright. Her circulation, which walking was supposed to improve, had actually worsened according to her last vascular assessment. She was walking every day. She was getting sicker every day. And the reason was not the walking. The reason was how she was walking. In the next 20 minutes, I am going to show you 7 specific mistakes that quietly destroy the joints, spine, and cardiovascular system of adults over 60. And I am going to show you exactly what Japanese and South Korean physicians have been prescribing instead for the past 3 decades, with measurable outcomes that Western medicine has simply chosen not to discuss. After 60, your body is not the same physiological environment it was at 40. This distinction matters more than most people are told. Your liver's detoxification capacity has declined by 30 to 40%. Your kidney filtration rate has been dropping by approximately 1% every year since you turned 40. Your cartilage, the smooth tissue that cushions every joint in your body, has lost a significant portion of its water content, making it measurably more brittle and less resilient to repetitive mechanical load. The synovial fluid that lubricates your joints takes longer to distribute after rest. Your muscle mass has been declining at 1 to 2% per year since your 50s through a process called sarcopenia, the age-related loss of skeletal muscle tissue. In Japan, clinical guidelines for adults over 60 have formally addressed locomotor syndrome, the progressive deterioration of musculoskeletal function, since 2007. In the United States, there is no equivalent clinical standard. That gap is not an accident. It is a consequence of a healthcare system structured around treating the outcomes of locomotor failure rather than preventing them. My name is Dr. Jae Yoon. I am a physician trained in both Western clinical medicine and traditional East Asian integrative medicine, and I have spent 26 years studying why Japanese and South Korean adults consistently outperform their Western counterparts on measures of functional mobility, joint preservation, and cardiovascular health well into their 80s. I want to be direct with you about why I am making this video. In 26 years of practice, I have watched patients damage their joints, their spines, and their cardiovascular systems while following advice they received in good faith from physicians who simply did not have time to give them the complete picture. The standard Western clinical appointment was not designed for this conversation. I am having it here because someone needs to. I do not have a pharmaceutical company funding this channel. I do not have an insurance system telling me which conversations are reimbursable and which are not. What I have is you, and the 20 minutes you are giving me right now. If this video reaches you, it is because someone pressed like and allowed the algorithm to carry it further. Without that like, YouTube buries this video permanently, and the person who needs it most never finds it. With your like, this reaches 100,000 people, and somewhere in that number is a 68-year-old man walking incorrectly every single morning, destroying his knees, and wondering why physical activity is making him feel worse. Press like right now, then subscribe. Every week I release peer-reviewed research your general practitioner has not read yet, and you will want to be here for it. And tell me in the comments, which of these 7 mistakes do you suspect you are already making? I deliberately left one common walking error out of this list. Write your guess in the comments and I will address it in the next video. Mistake 1. You start your walk at full pace. This is the most widespread error I observe across every fitness level and every age group. And after 60, it carries consequences that simply did not exist at 40. Here is the mechanism. Skeletal muscle at rest is cooler than active muscle by several degrees. Cooler fibers are significantly less elastic. Less elastic fibers sustain micro tears, microscopic ruptures in the muscle tissue, under loads that a warm muscle handles without damage. In younger adults, these micro tears heal rapidly and cause no lasting symptoms. After 60, with reduced satellite cell activity, the repair cells responsible for muscle regeneration, that healing is slower, and cumulative micro tear damage accumulates into chronic pain syndromes that most physicians will label as arthritis or age-related wear. A 2019 study from Osaka University tracking 4,300 adults over 60 found that those who warmed up with 5 minutes of slow walking before increasing pace showed 43% fewer musculoskeletal complaints over a 2-year follow-up period than those who began at target pace immediately. The correction requires 0 additional time. Spend the first 3 to 5 minutes of every walk moving slowly. That is the complete intervention. Mistake 2. Your posture is destroying your cervical spine while you walk. An adult human head weighs approximately 11 pounds when it rests directly over the spine in neutral alignment. That load is carried effortlessly by the cervical musculature. When the head shifts forward by just 1.5 inches, which is the average forward displacement observed in adults who walk while looking at the ground or at a phone screen, the mechanical load on the cervical spine increases to 44 pounds. That is a 400% increase in load on the same muscles and joints, sustained for the entire duration of the walk. Seoul National University published data in 2018 showing that chronic forward head displacement in ambulatory adults over 60 is independently associated with a 3-fold increase in cervical disc degeneration rate compared to adults who maintain neutral head position during walking. The secondary consequence is respiratory. When the head is forward and the shoulders roll inward, the diaphragm, the dome-shaped primary breathing muscle below the lungs, cannot fully descend. Lung expansion is restricted. Oxygen delivery to working muscle and brain tissue is measurably reduced. The correction is a single postural cue. Imagine a thread attached to the crown of your skull pulling gently upward. Eyes forward on the horizon, chin parallel to the ground, shoulders dropped and slightly retracted. That is neutral alignment. Mistake 3. You are walking in the wrong shoes, and you have been wearing them long past the point where they protect you. 2 age-related changes make footwear critically important after 60. First, the plantar fat pads, the natural cushioning tissue on the soles of your feet, thin progressively with age. A study from the University of Tokyo found that adults over 60 have on average 30% less plantar fat pad thickness than adults under 40, meaning the natural shock absorption your feet once provided has been substantially reduced. Every ground impact force that your foot pad previously absorbed now travels upward through the ankle, knee, hip, and lumbar spine without attenuation. Second, the intrinsic muscles of the foot weaken with age, allowing the medial arch to collapse, a process called acquired pes planus. Arch collapse shifts the entire mechanical axis of the lower extremity, increasing valgus stress on the medial knee compartment and compressive load on the hip. The solution requires 3 things in every walking shoe: genuine cushioning in both heel and forefoot, medial arch support that follows your foot's natural anatomy, and a flexible forefoot sole that allows your foot to complete the natural heel-to-toe roll without resistance. Replace your walking shoes every 12 months, regardless of how the outer sole appears. The midsole materials that provide cushioning degrade long before the rubber wears visibly. Mistake 4. You walk once or twice a week for a long time rather than daily for a shorter time. This is one of the most consequential errors in the list because it generates the illusion of a healthy habit while delivering a fraction of the biological benefit. Your body does not respond to isolated effort. It responds to repeated, consistent signals. Every time you walk, your cardiovascular system receives a stimulus. Your heart adapts. Your blood vessels adapt. Your muscle tissue responds. This process of adaptation, called training adaptation, only occurs when the signal is delivered consistently enough for your body to recognize physical activity as the norm rather than an exception. A single long walk after 5 days of inactivity is not a training stimulus. It is a stress event for unprepared tissue. The muscles, cold and unadapted, sustain more micro-tear damage than they would from a shorter walk on a conditioned body. The joints, not yet producing adequate synovial fluid for sustained load, experience higher contact stress. A landmark study from Tufts University following 6,200 adults over 60 for 8 years found that those who walked 20 to 30 minutes 5 to 6 days per week showed 57% lower all-cause cardiovascular mortality than those who completed equivalent total weekly distance in 1 or 2 sessions. Frequency is not a preference, it is the mechanism. Mistake 5. Your arms are stationary while you walk. This mistake looks harmless. It is not. Walking is a full-body cross-coordination pattern hardwired into your neuromuscular system. When the left leg steps forward, the right arm swings forward in opposition. This is not stylistic. It is biomechanically necessary. The oppositional arm swing counterbalances the rotational force generated by each stride, distributing load symmetrically across the thoracolumbar spine. When the arms are held stationary at the sides or placed in pockets, the spine must absorb that rotational force uncompensated. In adults with any degree of lumbar disc degeneration, which includes the majority of adults over 60, this uncompensated rotation is a direct trigger for acute and chronic lower back pain episodes. The secondary consequence is metabolic. Active arm swing recruits the deltoid, trapezius, and pectoral musculature simultaneously with the lower extremity muscles. A study from Kyoto University found that walking with correct oppositional arm swing at 90-degree elbow flexion increased total metabolic expenditure by 17% compared to the same pace with static arms, with no increase in perceived exertion. The same distance, the same pace, 17% more physiological work. The correction? Bend your elbows to roughly 90 degrees, allow them to swing forward and back in natural rhythm opposite to your foot placement. That is the complete adjustment. Mistake 6. You walk with a phone in your hand or you walk while looking at a screen. I want to address this one with particular directness because the consequences are more serious than most people recognize. The postural damage from phone in hand walking is an amplified version of mistake 2. When you hold a phone at waist level and look downward at it, your head is not displaced 1.5 inches forward. It is displaced 3 to 4 inches downward and forward, generating a cervical spine load of 60 to 80 pounds sustained for the entire duration of the walk. But the more serious consequence is neurological. After 60, the vestibular system, the balance and spatial orientation apparatus in your inner ear, begins to operate with declining precision. Simultaneously, proprioception, your body's capacity to sense its own position in space, begins to deteriorate. These two systems together are what allow you to walk on uneven surfaces without conscious effort. When your eyes are on a screen, your brain is deprived of its primary compensatory input for declining vestibular and proprioceptive function. You stop seeing the surface you are walking on. The risk of a fall increases substantially. In adults over 65, the statistics from the NIH are unambiguous. Fall-related injuries are the leading cause of injury death in that demographic. A hip fracture after 65 carries a one-year mortality rate of 20 to 30%. The prevention is absolute. The phone stays in your pocket for the duration of the walk. Mistake 7. You ignore recovery after walking, and this is the mistake that silently erases all the benefit the other corrections would have generated. Most adults treat a walk as a complete self-contained event. They finish, they sit down. They do not think about it again until the next walk. From a physiological standpoint, the walk is not where adaptation happens. Adaptation happens in the recovery window immediately following exercise. This is when muscle fibers repair and reinforce. This is when the cardiovascular system restructures in response to the load it just experienced. This is when the joint tissues remodel. Without conscious management of that recovery window, the adaptation is incomplete. 3 elements are non-negotiable. First, hydration. Muscle tissue is 70 to 75% water. Even mild dehydration, defined as a 1 to 2% reduction in body fluid stores, measurably reduces muscle elasticity, slows cellular repair, and increases cramping risk. Drink a full glass of water within 15 minutes of finishing your walk. Second, stretching. Walking contracts the calves, hamstrings, hip flexors, and lumbar paraspinals repeatedly without lengthening them. Without 5 minutes of post-walk stretching targeting those 4 areas, accumulated shortening produces chronic stiffness and restricted joint range of motion within weeks. Third, recovery days. 1 to 2 days of rest per week is not optional. It is when adaptation occurs. Eliminating rest days does not accelerate progress, it eliminates it. What I have described in this video is not complex. It does not require equipment. It does not require a gym membership, a personal trainer, or a prescription. It requires a change in how you walk, a change that costs you nothing and that Japanese and South Korean preventive medicine guidelines have been formally recommending since the 1990s. The contrast with what Western medicine offers is worth stating in concrete numbers. Managing the downstream consequences of cumulative joint damage from incorrect walking, knee replacement surgery, lumbar fusion, hip replacement costs between $40,000 and $120,000 per procedure, not including rehabilitation, lost income, or the secondary complications that occur in a significant percentage of older adults post-operatively. The total out-of-pocket burden for an adult who sustains 2 joint replacement procedures in their 70s, accounting for deductibles, rehabilitation, home care, and secondary care, typically exceeds $80,000 over a 5 to 10-year window. The cost of a quality walking shoe with proper arch support and cushioning is $60 to $120 annually. The cost of the other 6 corrections in this video is zero. The pharmaceutical and surgical industries that profit from joint replacement and chronic pain management have no financial incentive to tell you that the problem was how you were walking. That is not a theory. That is how the billing structure of Western healthcare operates. It tells me something about you that you are still here. Most people leave before the part that actually changes something. You stayed. That tells me you are serious about the years ahead, not just about surviving them, but about walking through them without pain, without dependence, and without handing the medical system the $80,000 it is waiting to collect. Press like on this video right now. Somewhere tonight, someone is sitting in a hospital waiting room with a knee that has been quietly destroyed by 20 years of walking incorrectly, waiting to be told that surgery is the only option left. Your like gets this video in front of that person before they reach that waiting room. That is not an exaggeration. That is how the algorithm works. Then subscribe. Over the next 4 weeks, I am releasing 3 videos on the specific foods that accelerate joint cartilage regeneration after 60, all of them validated by peer-reviewed data from Osaka and Seoul National University, none of them ever mentioned in a Western rheumatology guideline. And share this video with one specific person, the person in your life who walks every day and wonders why their knees are getting worse instead of better. They need to see this before their next orthopedic consultation. Dr. Jae Yoon, the science Asia has always known. Take care of yourself, I mean that.